家晚安，欢迎您准时收看娱乐漫谈，我是周乐。记得吗？我们到 San Jose 的 Dr. Jane 的 clinic 来访问到 Dr. Jane， 他就是我们今天的嘉宾，让我们热烈的来欢迎他出场。Hello, Dr. Jane, welcome to our show.
Hi, hello.
Hi, 你好吗？Very good. Dr. Jane, would you like to say hello to our San Francisco audience?
Of course. Audience in San Francisco, 你好吗?
Okay, Dr. Jane, before we go on the subject today, I would like to ask you a question which has been asked from several audience about last time's all therapy.
Right.
They are all interested and they are concerned about the pain level. How do you manage the pain?
So we do give the oral relaxing agent, so you can be more relaxed and then sleepy, so you don't mind, little pinprick pain.
Okay.
And then we do put topical numbing.
Okay. What is the for me to work to get the best result, to get the less pain?
And half hour.
Okay. It's non-invasive, 微整, but it's on the nose job. People love to have a nose bridge and a very full, very tall, very full nose. 非常亨通，或者是财源广进，或者是桃花满满。To have a good, to me, you know why? I wear eyeglasses and I wear sunglasses. I hate this two-part hit my cheekbone. So if I have tall enough nose bridge, it will solve the problem.
Right.
How 微整 non-invasive nose job to be performed perfectly?
Okay, so non-surgical nose job means that exactly I don't use knife, but I use filler. There are so many kinds of filler.
Okay.
So to make nose bridge higher, or sometimes I do make the nose a little peepee and then narrow as well.
All by the filler.
Or by the filler.
So it's the injection.
It is injection.
Tell us about how many kinds of filler there are, and among them, which one you don't recommend, and which one is the one you'd like to use on the patients.
So roughly, there are two kinds of filler. So one is going away filler, which is Jubitum or the radius.
Oh. And how long they last? About 6 months or a year?
6 months to an year.
Okay. But you see, we don't move our nose that often. Even for the temporary kind of filler, it will stay longer than 6 months though. Unlike the jaw, you move around so much, maybe it will travel.
So as you said, the filler on the lips, where you move around so much, it goes away faster. But nose, you don't move your nose that much, so it lasts a little longer. And then when you repeat the procedure, even with the hyaluronic acid filler, going away filler, it is gonna last more than a year.
Okay, so those are not the one you recommend in this clinic. And which one do you recommend?
One of my favorite filler for the nose is called Bellafill.
Bellafill.
It is longer lasting filler. So
longer lasting.
It
has been FDA approved.
It is FDA approved in 2007.
所以大家知道，美国这个国家对于很多的药品，他们的 FDA 管制是非常严的。We know how serious U.S. FDA approval is. Unlike in Europe or Taiwan or South Korea,
right?
They use a lot of off-label thing which has not been approved by U.S. FDA, yes.
Right. I only use FDA approved filler because it is for my patients' safety.
Is that the liquid base or gel base?
It is gel base.
Is it suitable for everyone?
Not really. For the Bellafill, it requires a skin test. So if you are not allergic to it, you can use Bellafill.
Okay.
But when you have an allergy to Bellafill, I do use Jubitum. Or for the person who never had a filler before, I do recommend going away filler such as
Radius.
Jubitum or the Radius.
OK， 我知道这个 Radius 它的中文名字叫做细胶瓷，这种东西是短效性的，所以 Dr. Jane 用的是比较长效性的。What what if this patient, he or she has nose job done in elsewhere, and he remember, or sometimes they don't remember what kind of the filler that doctor implant on his or her nose? Will filler fill work and work comparable with other filler? Will that become an issue?
First of all, that I can perform any kind of filler on the implant. Solid implant, silicone implant, there is no problem with the caution. But for the filler, before, I like to know the name of the filler first. So you have to know the name of the filler for your safety as well.
OK， 所以观众朋友他说，如果自己的鼻子已经经过传统性的 nose job， 就是里面有塞一个东西，事实上这个 filler fill 还是可以放进去的。但是如果您在别的地方有做微整鼻子，如果您不知道用的是什么材料，还是要去问那个医生，要find out比较好，因为有的是不相容的，有的是相容的。Tell us if somebody walking with you and he says I'm not, or she says I'm not satisfied with my nose. For most Asian, it's like the vegan position. But you will fix the whole nose.
I would fix whole nose, not just on the bridge, because it is not working that way, because it's the face and your face. I have to see the big picture, and that nose has to fit on your face.
The nose has to fit on your face. Thank you so much, Dr. Jane.
Thank you so much.
Thank you. Okay, say bye-bye to San Francisco audience.
Bye. 谢谢。
不客气。好的，观众朋友，我们这个访谈就到此结束了。非常感谢您的收看。如果大家需要任何的 consultation 的话，记住第一次是 free 的，请来找 Dr. Jane。